In the name of God, most gracious, most merciful, we would like to welcome our speakers in this press conference of the National Taskforce for Combating Coronavirus, COVID-19. His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, Her Excellency Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live and on the YouTube channel of the Ministry of Health in 5 different languages, and we also have the journalists and reporters joining us remotely. Now we begin as usual with His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has everything held within His knowledge. Praise be to Him for His countless blessings. Praise be to the Prophet. We would like to welcome you all to this press conference through which we aim at informing you on the most recent updates regarding dealing with COVID-19 in the Kingdom of Bahrain. The Kingdom continues at all levels and fields to combat the coronavirus. The Kingdom has different aspects at the GCC, regional, international levels to fight this virus and share information and knowledge. And to continue on this path, the Kingdom of Bahrain participates in the Phase 3 clinical trial in cooperation with the United Arab Emirates through G42 company that is based in Abu Dhabi. These trials come as part of the partnership between G42 and the Chinese company, pharmaceutical company that is Sinopharm, the 6th company that produce vaccines. This vaccine is inactivated. It means it does not cause infection, and later, Dr. Manaf Al-Qahtani will give you these details regarding this vaccine. We confirm at the same time that everyone should follow the guidelines and instructions to mitigate the spread of this virus. The work is ongoing based on the recommendations of the National Taskforce to reopen certain sectors gradually. This gradual reopening will take into consideration certain elements to assess the situation, whether to be reopened or closed. First, the daily tests, and everyone should keep this in mind. Also, the cases that are critical out of the total active cases, and this indicator will give us an idea about the occupancy of the hospitals, especially the ICUs, so that we can organize the work in this sector. Also, the occupancy in the isolation and treatment centers, and we always ensure to provide these figures in this press conference. Last week, the sports gyms, the outside sport fields and swimming pools were reopened, and instructions were issued for the authorities concerned. So please keep in mind that everyone, citizens and residents, should follow these guidelines and instructions, and based on the results, the decisions will be reviewed continuously. So the decision is at your hand. As long as you continue following these guidelines and instructions, which will mean eventually that life will go back to normal, and vice versa. If you become reckless, then we might go back to close these places gradually. So it is vice versa. If you follow these instructions strictly, the more quickly we'll go back to normal life, and vice versa. Now, let me review the total numbers of the occupancies. As for the occupancy of the isolation and treatment centers stands at 8,357, of which 1,752 are occupied, and this is just 21% of the current occupancy. As for the home self-isolation, 1,383 cases, and they do not suffer from any symptoms, and they meet the certain conditions for such isolation. As for the recovered out of the active cases, stands as for the death, 0.4 of the active cases. To conclude, we confirm that we're going to follow these instructions and guidelines with determination in order to combat this virus and overcome this challenge. Now, I'll leave the floor to my colleague, Dr. Manaf Al-Qahtani, to proceed. Thank you very much, Your Excellency, Dr. Walid Al-Mana. In the name of God, most gracious, most merciful, at the beginning, we have stopped for a certain period of time, so I would like to welcome you to this press conference, and I confirm and remind everyone to follow all the precautionary measures and guidelines which will mitigate the spread of the virus, and I pray God that we shall go back to normal life and that the medical team will overcome this challenge and will give you good news soon. As mentioned by Dr. Walid Al-Mana, as for the clinical trials that we started already last Sunday for the inactivated vaccine, this is the third phase that the Kingdom of Bahrain is participating in with the collaboration of United Arab Emirates through G42 company, and this comes in partnership between China National Biotech Group, that is under the Sinopharm, which is the biggest pharmaceutical companies around the world, and G42 for healthcare, which is one of the companies that is under G42 that is based in Abu Dhabi. Before I start talking about the clinical trials in Bahrain, just to give you a brief on the vaccine. The vaccine is a medication that would give us antibodies. It is not treatment. It is like protection against certain disease. So there is difference between medication and vaccine. And at this stage, in any pandemic, vaccine will be the best method to end a pandemic. Everyone knows that developing a vaccine would take some time, but thank God we have managed to announce the name of the virus and the genetic lines, so that gave the scientists enough time to conduct research and papers until we have heard now of these clinical trials. And due to the technology that has preceded this operation and make the vaccine safe, and there are so many scholars and scientists to quickly create and produce this vaccine to end this pandemic. The listed vaccine in this clinical trial is under the umbrella of the World Health Organization, and it is one of the vaccines that is known and used before, which is called inactivated vaccine. It includes inactivated virus that would not cause by any means COVID-19, but this vaccine, inactivated vaccine, would create immunity to create antibodies that would, God forbid, if somebody got infected, that will be with mild level. The vaccines go through different stages, and it is very important to understand the process. There are different stages to produce a vaccine. There are stages before the clinical trials, and the rest will be after during the clinical trials. Well, before the clinical trials, the virus will be studied in labs and will be the item or substance that would create the vaccine, and it will be tested even tested on animals, and after passing these 3 stages, it will go into animals, and if proved successful, it will go into what we call the clinical trial, and it is divided into 3 stages. The first stage, it will be tested on tens of people, of healthy people, volunteers, and they will be followed up, and if by any chance proved that it does not cause any complications and it started to cause antibodies, these tens people would move to the second phase, which will include hundreds of people, but less than 1,000, and again will be studied and assess the complications until we go to the third phase of the clinical trial, and which is implemented now in the Kingdom of Bahrain, which include thousands of people with follow-up to them to ensure the safety and efficiency of this vaccine, and would it be really creating antibodies and be protection for COVID-19. The experience of the Kingdom of Bahrain is unique, and it is one of the clinical trials that would include 6,000 citizens and residents in the Kingdom of Bahrain, and this is another achievement to the Kingdom of Bahrain because this is one of the first leading experiences through research, and it would include the name of the Kingdom of Bahrain as among the countries that have participated in creating and producing successful vaccine for humanity and to end this pandemic. We already started yesterday participating or calling upon volunteers to participate in this clinical trial as long as they are over 18, and the medical team will follow up this process and assess these volunteers before joining the clinical trial, and they will be followed up for a period of 12 months. I note again that the production of this vaccine is one of the regular vaccine production like the influenza vaccine, and it is one of the scientifically credited approved vaccines. And to conclude, I would like to wish this trial to be successful, and hopefully it will be approved as one of the treatment and vaccines to mitigate the spread of this virus, and which will make the Kingdom of Bahrain and give it a print around the world. And my last word to volunteers: please volunteer for humanity to end this pandemic, and we would provide great help for humanities. Now I'll leave the floor to Dr. Jamila Salman, infectious and internal disease consultant at Salmania Medical Complex, to shed light on the recent updates. Thank you very much. In the name of God, most gracious, most merciful, welcome again to this press conference to shed light on the most recent updates regarding COVID-19. Please follow all the instructions and guidelines issued by the authorities concerned, and to be committed at all stages so we can finish this pandemic at a very short period of time, and to keep in mind the social distancing, and to prevent even within the same family. As for the COVID-19, as for the precautionary measures done by the Kingdom of Bahrain through the National Taskforce for combating coronavirus, these measures in order to mitigate the spread of the number of the active cases, and so we avoid having death cases, because the health of citizens and residents are among our top priorities. And some of the countries around the world, they have successfully mitigated the spread of this virus, and even for reopening the establishments and activities, they went quickly, but then later went to the increase in the number of the active cases, and so they closed again the establishments. Well, we don't wish to have such a thing in the Kingdom of Bahrain. As for the plan, here we have a gradual plan to reopen the establishments and activities according to certain indicators that we have explained before in certain stages, in order to protect this health and safety of citizens and residents. And if anyone would like to achieve or to do anything, they can do it. They can go out and do their job as long as they follow the instructions. And we say coexisting with the virus. When we say coexist with the virus, it means coexist smartly. How you can follow the instructions, how you be aware of this virus. So smartly means you follow and implement these guidelines and instructions. And now, after 5 months of having the first case in the Kingdom of Bahrain, now everyone, including children, they follow these instructions and guidelines, and it has become one of their daily routine. Maybe if anyone heard or watched the World Health Organization press conference, maybe you've heard of do it all. It means do them all, not just part of them. Personal hygiene, washing hands, using the tissues. When you implement them all together, that would decrease the number of the active cases. As for the tests in the Kingdom of Bahrain, and among the achievements, among the successful indicators we're doing are the tests. So we have increased the number of the random tests around Bahrain, and whoever wishes to conduct the test, maybe they don't have symptoms but they wish to do the test, so we're trying to do that, and so we can detect the cases at an early stage, and so we can provide them with the medication. And those with the symptoms, it's better they call 444 and they don't just go as part of the random test. The third one are the contacts. So contacts, if they were enlisted as contacts, they will be called by the team. So please, if you are contacts and you are implementing home isolation, please stick to the period of time of self-isolation. So being home self-isolation for 10 days and then conducting the test on the 10th day is very, very important, because some of the cases would transfer from negative to positive within these 10 days. And that's why you stick to these number of days until you are fully recovered. This is very important. As for the tests, and it's important, we have reached over 900,000 tests. Now for the active cases under critical, we have 38. As for the cases receiving treatment, there are 97. As for the stable cases, 3,097. And thank God, with the collaboration of everyone and implementing the health protocols, we are at constant contact with all these scientific organizations regarding sharing knowledge about the medications and etc. So we call upon everyone, as usual, the main elements and following the instructions and guidelines, all of them wearing masks, unless like exercising certain activities with great efforts, even wearing face masks, even within the same family. If I am a medical staff and I'm living with some elderly relatives or with weak immune system, then I should wear the face masks. Even washing hands, we say regularly, disinfecting the surfaces and disinfecting the items coming from outside home, using the tissues while coughing or sneezing. These are very important guidelines. And also, whenever you have experienced any symptoms, call 444. So please collaborate with all the sectors, the medical staff, the frontline people, and we have seen the results. Hopefully we're going to continue this successfully, and hopefully it's going to be a very short period of time to end this pandemic. Thank you. Thank you very much, the speakers, for your briefs. Now we move to the question and answer section from the reporters and journalists who are following us remotely. Question to Dr. Walid from Ayman Shakal, Al-Watan newspaper. To what extent it is true that the Russian vaccine is like successful, and would Bahrain contract with Russia or wait for like American vaccine or other types of vaccines? Thank you. It is a very important question. Well, any vaccine from anywhere, it has three different stages, as mentioned by Dr. Manaf. The first, second, third, fourth phases, and some even would take longer than this. If you have remembered, some vaccines would take like 18 months to make sure that, like, a year and a half. And according to the technology implemented, all we know is that it takes time. So my comment for any vaccine, these phases, they have standards, international standards, and the World Health Organization is in charge of assessing these vaccines and approving them. And they can come to a stage of production and then spreading these vaccines. So my comment, any vaccine, if it has met all the standards and approved internationally by the World Health Organization, then definitely the Kingdom of Bahrain is going to take the initiative to buy the vaccine or any other vaccines, because there are certain standards we are obliged to follow. So mentioning a country or doubting the efficacy of that vaccine from a country, it is, generally speaking, any vaccine, it has standards. Once approved internationally, yes, Bahrain will be among the countries to take this one. And another question to Dr. Walid from Tamam Busafi from Al-Ayyam newspaper: with Ashura rituals, are there any fears that there will be some illegal gatherings and which will increase the number of active cases? Well, I would like to confirm that the National Taskforce is concerned on the assessing the medical situation, and among the important tasks to assess all the gatherings and how or the impact of allowing these gatherings or banning them. Take into consideration the spread of the virus within the society. By allowing the religious rituals or banning them goes back to the consultation and discussion among the task force, National Task Force, and the Supreme Council of Islamic Affairs, and we put the health and safety of the citizens as a priority. So we need to follow what is issued by the Supreme Council of Islamic Affairs, and hopefully the awareness of the people and following these instructions and guidelines and being aware of their health and safety is the big assessment. So we know that this society is aware, and they are aware of every single word we're saying, and any decision taken, it is for their sake. Thank you. Question from Rasha Al-Ibrahimi, Gulfdale News. To Dr. Manaf, it has been announced the volunteering for the third phase for the clinical trial. Are there any volunteers yet? And do you expect a large number of volunteers? Thank you for the question. Thank God, we have started the official announcement yesterday, but we started the clinical trials from last Sunday before the official announcement. I think anyone who would see the place of the vaccine will rest assured and will be encouraged will feel so much assured regarding this, because we have the trust of the society, whether citizens and residents, on the National Task Force. So far, we have 70 volunteers up to now. And since the official announcement, a large number of volunteers were registered, and they were listed according to the timings, because we have a mechanism for injecting this vaccine in the clinical trials. So we are optimists, and we are optimistic, and before our announcement, we received many calls, and over the coming days, we will have more volunteers, as long as people will rest assured that this vaccine was already studied before trying the clinical trials. Question to Dr. Jamila Salman from Jamal Al Yaqut from Saudi Al Jazeera newspaper. It is noted that the COVID-19 cases would spread the virus before experiencing the symptoms. So how to avoid such a thing? A very important question. Well, spreading the virus before experiencing the symptoms, all the scientific studies, they followed the patients before and after having contacts, and they saw that before experiencing the symptoms, they have spread already the virus, and it depends on the getting the virus within the body. So it is inside the body as a virus, and before the symptoms. That's why in the Kingdom of Bahrain and in previous conferences, that's why we follow all the contacts. Once we see the positive result, we follow the contacts even days before the results, so we can list all the contacts and make sure that even if they don't have the symptoms, they stay at home as self-isolation, and after 10 days, just to make sure that they don't go into positive cases. And that goes back to the same main important point, following the guidelines and instructions, wearing face masks, washing hands, and if we are within same place of contacts, so within these precautionary measures, we're not going to spread the virus. Question to Dr. Manaf from Fatma Ali, Akhbar al-Khalij newspaper. What are the assurances provided by the National Taskforce to citizens and residents to encourage them to join this clinical trial? Well, the readiness of the place and the Emirati and Chinese teams, they have seen the place and they praised it. We have set it up within a very short period of time, and also the great spirit of the National Taskforce, and they will see that by your eyes to what extent this team is ready and knowledgeable, answering all the questions. Number 3, we've studied this topic seriously in July from all aspects. The medical, like we have the medical team, studied from all aspects, and then we reviewed it to Nahra, and the first committee was reviewed it, the clinical trials committee, to make sure that all the medical standards are met, and also it was reviewed by a different committee called the Studies Moralities Committee, to ensure that this aspect is done, and after approving that at all stages, we have provided all the medical requirement and conditions. And the 4th thing, that this virus is one of the pre-qualified vaccines listed under the World Health Organization. As for the other assurances, after taking the vaccine, volunteers will be followed up for 12 months, and they will be assessed on a daily basis for the first 2 weeks on phone. They will be receiving calls, and there will be a diary for a volunteer to fill it in to ensure that if they have any symptoms, they have a hotline that the volunteers can call us, and also special email if they have any inquiries. And this is the first injection, and after weeks we will do the same thing. We will have certain tests, so a year will be enough that someone will be really assured. If there are any complications, there will be specialized doctors to check the efficiency and safety of this vaccine. And these are among the procedures that we're taking. And I want to assure everyone, this vaccine was studied for a long period of time, and it is not new. It is called inactivated vaccines. We tested it for for the many things before, so it is not something new. The second thing, it was studied by specialized people, and it was approved after a comprehensive study by the National Regulatory Authority, NAHRA. So by itself, this is sort of assurance for volunteers. Question to Dr. Walid Al-Manak from Budur Al-Maliki, Al-Biladi newspaper. How do you assess the new active cases after Eid al-Adha and the new active cases after Eid al-Fitr? If you compare that, does that need more responsibility? Well, I think it is very early to assess after Eid al-Adha because it was 6-day holiday, ended last Tuesday, and today is Wednesday, so we're like 8 or 9 days, so we're still at the incubation period of the virus. But commenting on the first phase, as you can see, it did not go up really high, but at the same time it did not go down. So after Eid al-Fitr, we had a huge increase in the number of due to the gatherings of the families, but then gradually went down, let's say maybe after Eid al-Adha. So now we cannot assess, let's say, the final assessment because it is really early. We're still within the incubation period. We're still assessing the R0 and the spread of the virus. Hopefully it should not go up, and that would prove the awareness of the people within the coming period of time. Thank you very much, the speakers. Thank you for the speakers for their briefs and answering the questions. We also thank you, ladies and gentlemen, for listening and watching. And before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of this virus. Thank you very much.